What up YouTube, my name is PhysioJoe and today we are talking about what we are actually doing with a physiotherapy program of care. Before we get started, hit that subscribe button. This channel is the perfect channel for you if you are fighting any fight against chronic or acute pain and you are looking to rid yourself of that so that you can live long life full of pain-free moments. So we're gonna get right into it. When it comes to physiotherapy programs of care, we are really considering kind of three things. The first one is pain and the acuteness of it. The second one is muscular imbalances or load sharing issues. And the third is increasing the functional capacity of the unit that we are looking at. Let's get into all three a little bit more in-depthly. Number one, the level of pain is important. If someone comes into the clinic and the area of pain is extremely acute, I can't even move them too much without excruciating pain, that is something that needs to come down. So in order for us to make change on the body, we have to challenge it. Unfortunately, pain, and when it's flared up and really bad, isn't a good time or space to really be challenging your body because it's just too sensitive. You're not gonna like it. You're not gonna wanna do more. So before we even get started, when someone comes in with these kind of acute pain symptoms, the first step is just calming it down. So when it comes to calming down a certain area, we got all sorts of nice, easy suggestions. Number one is rest from anything that aggravates it in a realistic kind of way. Two, you got ice, you got heat. Those kind of things can really help calm things down. Number three, you got those kind of muscle creams, Deep Blue, Voltaren, 8535. They're a great way to, soothe some areas when they're really angry and yelling at you. Sometimes even immobilization as extreme, getting a sling for that shoulder, putting a knee brace on for a little bit of extra support. Those things kind of work to settle down a painful joint. So that is our first consideration. If the joint, is very angry, we're gonna be kind of just working to calm it down. But when it's at a manageable pain level where you can still do some stuff and it's not super angry, that's when we start to work on the other things, which are gonna help make you better, build a better version of yourself, and challenge the body to grow and overcome the painful signals that our brain is giving us. Number two, checking for muscular imbalances. And by muscular imbalances, I simply mean that we have over 200 muscles in the body, and based off of our lifestyle habits or lack thereof of physical activity, postures from work and life, past injuries can all affect how the muscles in and around the area of pain are sequencing and firing up. And the reality is, if you're having pain in a certain area, there's something about some of the muscles in that area that are affected and need to be addressed. Addressing these muscle imbalances is kind of a nice way to reset balance, optimize the body to the way that it's supposed to be working well. And from there, we can use that as a platform to get to our load strengthening, functional capacity part of the rehabilitation process. So the unfortunate reality though is with the muscle imbalance portion, that does require an expert of some sort who knows how to look into the body from the outside and assess and draw conclusions from the way you move, the way your muscle tests fire up, the way your range of motion kind of looks, and give you that insight and work with you to kind of optimize and restore balance to the areas that are maybe imbalanced. And lastly, we have load building capacity. Okay, so of a certain area of the body, let's say the knee is a part of the functioning unit, which is the ankle, the knee, the hip, which is the leg. And something like the shoulder is a part of the shoulder, elbow, wrist complex, which is the upper extremity functioning unit. And oftentimes when you are in pain, especially for long periods of time, we're talking over 3 months, some people come in 6 months of pain, 1 year of pain, you're gonna get some load capacity problems, and we need to start to reintroduce it because the reality is our body doesn't like to feel pain. We don't like to feel pain. So when things start to get sore, our first natural tendency is to kind of avoid the area offload it. This offloading strategy, while good in the short term, kind of patterns you out of use of this arm, setting you up for a downward cycle with that area, whether it's your leg or your arm or your back. So this is a 3-month structured intervention program where we're introducing load to that affected body part. And I'm not talking about gym stuff, like loading up on heavy barbell squats or deadlifts. Those kind of exercises are reserved for when the body is working well and feeling well. When you're not there, you need to take a step away from that, work your way up the physio progressions of loading a joint. And that can take up to 3 months of consistent effort, 2 to 3 times a week. So that is the third thing we are trying to kind of work at when we're talking about a physiotherapy program of care. Awesome, guys, that's pretty much it. Hopefully that gave you some insights into the physio mind a little bit. This is just my perspective. Every physiotherapist thinks differently, has a different base that which they approach healing the body, and that's based off their own life experiences, and you need to find someone that connects with your style a little bit. This is just mine. We're gonna try to decrease that pain to a manageable level where we can do stuff. I'm gonna be doing my thing to optimize the area of pain from a muscle imbalance, stretching, strengthening, targeted movements, and then from there, we gotta build up that load capacity. We gotta make that area stronger over a 2 to 3 month period. And so in that process, you will get better and you will feel like you can do more, live more free, and be that pain-free version of ourselves, which is the best version of ourselves. So again, PhysioJoe, fine-tune your physio. Share this with a friend that is confused about the physiotherapy process. Give them some insights so they can have a better understanding of what a good program should entail. Thanks again.